Hi, Mrs. Fairbanks. My name's Ashley. I'm a student
Hi, Ashley.
nurse. You just had a baby.
Yes.
How is she doing?
She's doing wonderfully.
Good. And how are you doing?
Pretty good.
Okay. I just wanted to talk to you about a few things that you will be experiencing with your baby now. Do you plan on breastfeeding?
Yes.
Okay. Because breast milk gives your baby all the nutrient needs to grow and develop. However, there are some problems that may occur.
My boobs aren't normally this big.
Oh, okay.
What's up with that?
That's called engorgement. It's a common response of the breast to the sudden change in hormones and increased milk volume. It usually occurs 3 to 5 days after birth and lasts about 24 hours, and feeding should occur every 2 hours to reduce engorgement.
Okay.
Breast pumping can also be done during engorgement. However, this will not be a problematic increase in milk supply. When you do breastfeed, this may cause some nipple discomfort, almost making you not want to breastfeed because you're in so much pain.
Okay.
It is normal though, but to prevent it, you can reposition your baby and help her latch on better to decrease pain. You do not want to use any nipple creams, ointments, or any other medicine on your breast while breastfeeding. You want to also avoid using new soaps to wash your bras. You can place warm, wet compresses such as tea bags on your nipples to decrease the pain. And soap should never be used to wash the nipples because it can dry it out, causing cracks and even more soreness.
Okay.
You can also wear breast shells in your bra so that your sore nipples do not rub against your clothing.
Okay.
Leakage can also be a problem, and if that does occur, breast pads can be worn inside your bra. So if you're having any discomfort with the breast engorgement, you can use cold ice packs after breastfeeding, gel packs, cold compress, or even chilled cabbage leaves.
Oh, okay.
Just hold them right up to your breast.
Okay.
We're not sure why this works, if it's just the cold cabbage leaf or if
It
it's
sounds nice.
Yes, or some sort of product in the cabbage that reduces swelling. Also for engorgement, you can use a warm compress before feeding. Take a warm shower. You can also use anti-inflammatory medications, breast massage, and pumping. And if you do choose to use ice packs, only place for about 15 to 20 minutes, 45 minutes off between each feeding.
Okay.
Do you have any questions as of right now?
Yeah, I was planning on going back to work pretty soon. How does that work with having to feed the baby every 2 hours?
You can actually start breast pumping, and this will provide breast milk for someone else to feed the baby. Proper pumping techniques, you want to make sure you wash your hands, and procedure for pumping, you want to place one hand on your breast at the edge of your areola with your thumb above and fingers below, pressing in towards the chest wall, and gently compress the breast while rolling your thumb and fingers forward toward the nipple.
Okay, like this?
Yes.
Okay.
Repeat these motions rhythmically until your milk begins to flow. You want to maintain a steady, light pressure until while the milk is flowing easily. Pump for about 15 to 20 minutes, and pumping should imitate normal breastfeeding. So however long your baby usually breastfeeds, that's how long you want to pump for.
Okay.
It is okay to pump one breast while the baby is feeding, and you can also double pump on both breasts at the same time to save time and stimulate milk more effectively. And you can also store breast milk for a longer period of time. Are you familiar with that?
No.
Okay. You can store breast milk for 8 hours at room temperature. After that, you should discard it. You can refrigerate it for up to 8 days, and it can actually be frozen for up to 12 months. So you just want to make sure you write the date on it and rotate your stock.
Do I give the baby cold milk?
You want to thaw the milk in the refrigerator to gradually thaw it.
Okay.
You never want to microwave it
Okay.
because it can create hot spots.
Okay. Now, are my boobs always gonna be this big? Because that would be great.
Unfortunately, no.
Oh.
If you choose not to breastfeed, or when you are done breastfeeding, it will take about 7 to 10 days to return to a non-pregnant, non-lactating hormonal level.
That's quick.
Yes. It is important to not wear supportive bras because it can lead to mastitis and plugged milk ducts. If you're really uncomfortable, it's okay to express a small amount of milk to ease engorgement. However, expressing tells your body to make more milk, which increases the time you will be producing milk. You also want to avoid hot showers because this can also stimulate milk production.
Okay.
And I think that's all the information I have to give you. Do you have any more questions?
No, you were very helpful.
Okay.
Thank you.
Thanks, Travis. Try to say.